Hi, I'm Dr. Teh, talking once again about cannabinoid medicine. Cannabis as a medicine is very, very safe. CBD has no toxic amount associated with it, meaning you can eat as much of it as you like and you won't have any ill effects. THC is estimated to have a toxic dose, but it's in a level that it'd be impossible to consume. Additionally, there's no in the respiratory and cardiovascular center of our brain and brainstem, the area that controls our breathing and respiration, there are no cannabis receptors. So at no matter how high a level of cannabis consumed, it's impossible to stop your breathing and respiration. So it's a very, very safe medication. There are some side effects to cannabis, most of them coming from the THC component, but they're all generally mild. We can get tiredness, we can get anxiety at high doses, we can get the munchies or increased appetite, but that can actually be used therapeutically. We can get sedation, as I've mentioned, but these are all very minor. We can also get a slight drop in blood pressure, which can be relevant in some patients who have a low blood pressure already, or the elderly, in the sense that we have to watch out we don't fall over and break a hip or something like that. And you can get a slight increase in heart rate from THC as well. This is only relevant in really extremely unstable cardiac conditions such as angina. So very safe medications. There are some drug interactions associated with medicinal cannabis, but these are more to do with the metabolism in the liver. And this is once again more to do with cannabidiol. So looking at cannabidiol, when we're getting to doses greater than, say, 70 to 100 milligrams per day, it starts to affect an enzyme in the liver called cytochrome P450. Now, this enzyme in the liver is associated with metabolism of the majority of pharmaceutical medications we take. So the interactions are not really direct interactions with the cannabis medicine, but rather interactions with the liver and then subsequent metabolism of other medications. There are a few to think about, and it's more of a clinical thing that we think about as doctors in this sense, but some examples that come to mind will be warfarin. This is a blood thinner which is used a lot in conventional medicine. And at high doses of CBD, the metabolism of warfarin can be slowed down due to the antagonistic effect of CBD on cytochrome P450. What does this mean? It means that you might have increased warfarin levels for a longer time than expected if using in combination with high dose CBD. Generally, this doesn't come into effect for the majority of patients. It's only for extremely high dose patients. So people over 100 milligrams of CBD per day, we should take this into consideration. Also, a lot of anti-epileptic or anti-seizure medications are affected by this same enzyme pathway, as are a lot of antipsychotic medications. And as a general rule, any other psychoactive medications, so benzodiazepines and Valium and lorazepam, nitrazepam, alcohol and barbiturates, anything which causes sedation, the sedation effect of those conventional medications can be increased when used in conjunction with THC. Now, this can be actually used therapeutically, and there's a term called opioid sparing effect. So that means when you're using THC in combination with your standard opiates that are used for pain relief, the THC actually increases the pain relieving effect of the opiates. So we can use this in clinical practice in patients with severe pain, cancer pain, and neuropathic pain. And I find it's often important to look at the conventional medications in the fact that they may need to be reduced. So I often find chronic pain patients, I'm needing to reduce their conventional pain medications such as opiates, which of course reduces the large amount of side effects which are associated with opiate medications. Opiates are a big problem in Australia and around the Western world. So it's great that we can have a naturally occurring compound that can help us reduce our reliance on these opiates for pain relief in our patients. Thanks. I'm Dr. Teh.